Plague definition. Plague is a bacterial-borne infectious disease caused by the bacteria known as Yersinia pestis. In the Middle Ages, plague was known as the Black Death. Antibiotics are the treatment of choice for plague and are most effective when given early in the course of disease. Black Death. During the Middle Ages in Europe, peaking in the 14th century, the so-called Black Death began in China and made its way to Europe, causing the death of 60% of the entire population. Causes. In the natural state, the bacteria infect wild rodents. Plague can still be found in many areas of the world, but 90% of cases today occur in Madagascar and sub-Saharan Africa. Rats, ground squirrels, and mice are examples of animals that may carry the plague bacteria. Death graph. During that moment, 75 million of people lived in Europe, 25 million died, so 1 out of 3 people died during Black Death in Europe. Risk factors. Risk factors for plague include being bitten by fleas as well as exposure to rodents. Scratches or bites from infected domestic cats are also a risk factor. Incubation period. Symptoms and signs of plague usually develop between 2 and 7 days after acquiring the Yersinia pestis infection. Also, they may appear after only 1 day in cases of exposure to pneumonic plague. Symptoms or signs. The signs and symptoms of plague may take 3 forms. 1. Bubonic plague. Bacteria infiltrate the lymph nodes, causing enlarged, painful, tender lymph nodes called buboes. Accompanying flu-like symptoms include fever, chills, headache, and weakness. 2. Septicemic plague. This form of plague is a result of plague bacteria entering the bloodstream. Symptoms include fever, chills, weakness, abdominal pain, and shocks. 3. Pneumonic plague. In the pneumonic plague, the bacteria spread to the lungs or infect the lungs directly when infected droplets in the air are inhaled. It's transmitted from person to person. Transmission. Transmission occurs when fleas feed on infected rodents and then bite people. Transmission of pneumonic plague to another person typically requires direct and close contact with an infected person. Contagious period. The exact contagious period is not definitely known. It is believed that patients in the early stage of pneumonic plague pose little risk of transmitting the disease. Mortality graph. After Black Death, people in Europe start to have mortality against this virus. In this graph is going to be shown mortality of people back then, depending on the city where they came from. In Siena, they high 90%, in Barcelona 76%, in Florence 75%, Hamburg 66%, Venice 60%, Eastern Normandy 53%, and England 25%. Diagnosis. The diagnosis of plague is confirmed upon identifying Yersinia pestis organisms in a sample of blood or tissue from the infected patient. Diagnostic tests rely on culturing the organism, demonstrating the surface proteins of the bacteria, or identifying genetic material of the bacteria. Treatment. Antibiotics are effective in treating plague. Examples of antibiotics that can be used include ciprofloxacin. People with plague are very ill and may require additional treatment, including oxygen, respiratory support, and medications to maintain adequate blood pressure. Prognosis. Plague is a very serious disease, often life-threatening disease. About 50% of people with bubonic plague that die if their illness is not treated. The earlier the antibiotic treatment is given, the better the chance for recovery. Vaccine. There is no commercially available vaccine to prevent plague. Prophylactic antibiotics should be administered to individuals with known exposure to plague or for those who have come in direct contact with infected tissues or body fluids. Bioterrorism. Concerns about plague include the potential for its use as a biological weapon. Historical examples include the catapulting of infected corpses over city walls and dropping infected fleas from airplanes. Conclusion. The conclusion about this sickness or pandemic is that during Black Death, a lot of people died. It was horrible because 1 out of 3 people died during that time in Europe. Also, there's no vaccine to defend people against this sickness. There's only some medications